Word of mouth, you know, I think we really underestimate that and its impact. And oftentimes we're busy handing out our brochures, and meanwhile, word of mouth in the community is going a completely different direction. And I have to give you an example from my own life. I will admit to that I was growing up in the 50s, and at that point, I was never allowed to eat a popsicle. Now you'd say, why not? Okay, this is a health issue. My mother, who in fact was a medical social worker who understood all the science, who really, you know, knew medicine, heard from my Aunt Sarah, who did not have that background, on good authority from their cousin Belle, that eating popsicles chilled your system and made you more susceptible to polio. Now, if we think about our health belief model, for mothers in the 1950s, that whole issue of perceived threat, nothing was scarier than the specter of polio in the summer. Now, for some reason, I could eat ice cream bars and I could eat Dixie cups. They were cold, but popsicles was the magic food to avoid. Word of mouth. It was so powerful that even my mother, who had this health and medical background, it had an impact on her. My Aunt Sarah and her cousin Belle became the credible sources. So we really have to be attuned to those kind of issues. Literacy, of course, becomes an issue. If we're always giving people things to read and they can't read it, it's not going to be effective. Preferred language. And I want to talk about why I use that term preferred language. I'm not talking about first language, home language, English as a second language. We really need to ask people which language they would like to get what kinds of information. An example was a mother we spoke with who was Hispanic, who spoke Spanish as her first language, spoke English fairly well. And when she was going out to look for information, she had a child with disabilities. And she really wanted to know, you know, all that she could learn. She read things, she went on the internet, and people would kept kind of steering her to Spanish language information. She said, no, I really want this information in English because when I go in and speak to my doctors, I want to know the words they're using. But she said when she went to a support group to get support around the emotional impact of having a child with a disability, she said, then I wanted it in Spanish because that was the language of my heart. So we need to ask people, we can't assume, and figure out what works best. And it may be different things at different times and different kinds of information. And we have to understand the generational issues. Grandparents who may speak only their home language, parents who speak both, and then their children who may prefer English. The last thing I want to talk about under Cues to Action is we have to really think a lot about our materials and training approaches to make sure they're respectful and reflect the population and their values.
Another thing that we tend to do in the communities is we hand out these handouts. And Native people, a lot of times they will glance through them, but they're more interested in listening to what people have to say. You can read the handouts, you can read the materials later, but you won't all be together again to discuss it. So discussion and verbal communication is very important.
If you give them materials, they want to see themselves in it, see their community in it, be able to relate to it. If everybody looks not like them, or if there's a picture of someone from their background that's pejorative in some way, then that's problematic. So we always like to see, faces that are like ours when we look at things. Now we have to be careful, at the other hand, though, that we're not going to stigmatize any particular group, again, because in this country we have such a view of the individuals responsible for themselves and their health, so that if we do materials that show only one particular group in relation to a health issue, it can end up being stigmatizing. A good example of this was that I was doing some training and people were trying to think about how they would do a health promotion, risk reduction kind of program for Hispanic youth related to hepatitis C. And somebody said, well, we'll do all these great posters, we'll put them around the city, and we'll have pictures of all the kids, the Hispanic kids on it, until somebody said, wait a minute, that's going to make it seem like only Hispanic youth have problems with hepatitis C or engage in risky behaviors. So we have to think about that. And the bottom line, and we'll talk about this in the how-to, is that we have to get input from the community about how do they perceive it. But we really have to think about that. Last, I want to talk a little bit about this idea of self-efficacy. It really is a construct that comes from psychology. It really, is what it says. I think that I could actually do this. I could be effective in putting this change this behavior into practice. And there's a lot of things from a culturally and linguistically competent perspective we want to think about. Racism and its impact on people in this country is huge in relation to this issue of self-efficacy. The issues of distrust, the issues of bias, discrimination, stereotyping in terms of that. And this concept I have here of learned helplessness, again from the psychology literature. It's really kind of a concept that says that if you keep trying to do things to improve your lot, to make things good happen for you, and it keeps not succeeding, in this case because of racism, that after a while you begin to learn, you feel helpless, like you can't do things. So that when we have people who've gotten into that state, then we go to them and say, I want you to take charge of your health, and I want you to change this or that behavior, and then things will really be better. The chance that they're going to say, yes, I can make this change and it will make a difference for me, are really lessened. So we have to think about that as this perspective and context. So now what I'd like to talk a little bit about is some of the steps that we need to think about if we're going to create culturally and linguistically competent health promotion training.